Root canals are often feared by many people due to the misconception that they are incredibly painful and time-consuming procedures. However, with modern advances in dentistry, root canals have become much more efficient and comfortable for patients. In this video, we will explore the question, how long does a root canal procedure take? What is a root canal? Firstly, let's start with the basics. A root canal is a dental procedure that is performed to remove infected or damaged pulp from inside a tooth. The pulp is the soft tissue that contains nerves, blood vessels, and connective tissue. When the pulp becomes infected or damaged, it can cause severe pain, swelling, and even lead to an abscess if left untreated. During a root canal procedure, the dentist will numb the area around the tooth to ensure that the patient does not feel any pain. They will then create a small hole in the tooth to access the pulp chamber and root canals. The infected or damaged pulp is removed, and the inside of the tooth is cleaned and disinfected. The tooth is then filled with a special material to seal it and prevent further infection. How long does a root canal procedure take? The length of time it takes to complete a root canal procedure can vary depending on several factors, including the location of the affected tooth, the complexity of the infection, and the skill of the dentist. On average, a root canal procedure can take anywhere from 60 to 90 minutes to complete. The first step in a root canal procedure is to numb the area around the tooth with a local anesthetic. This can take a few minutes to take effect, but it is essential to ensure that the patient is comfortable and pain-free throughout the procedure. Next, the dentist will use specialized tools to remove the infected or damaged pulp from inside the tooth. This process can take anywhere from 30 to 45 minutes, depending on the severity of the infection and the number of root canals that need to be treated. Once the pulp has been removed, the inside of the tooth is cleaned and disinfected to ensure that all bacteria are eliminated. This step can take an additional 15 to 30 minutes to complete. After the tooth has been cleaned, it is filled with a special material to seal it and prevent further infection. The filling process can take anywhere from 15 to 30 minutes, depending on the size of the tooth and the complexity of the filling. Overall, a root canal procedure can take anywhere from 60 to 90 minutes to complete. However, in some cases, multiple appointments may be necessary to ensure that the infection is completely eradicated and the tooth is properly sealed. Is a root canal painful? One of the biggest concerns that patients have about root canals is whether or not they will be painful. While it is true that root canals have a reputation for being painful procedures, modern advances in dentistry have made root canals much more comfortable for patients. During a root canal procedure, the dentist will numb the area around the tooth with a local anesthetic to ensure that the patient does not feel any pain. In some cases, patients may experience some discomfort or pressure during the procedure, but this is usually minimal and can be managed with over-the-counter pain medication. After the root canal procedure is complete, it is normal to experience some mild discomfort or sensitivity in the treated tooth. This can usually be managed with over-the-counter pain medication and should improve within a few days. If the pain persists or worsens, a root canal procedure typically takes anywhere from 60 to 90 minutes to complete. While the procedure may be feared by many, modern advances in dentistry have made root canals much more comfortable and efficient for patients. If you are experiencing tooth pain or infection, it is essential to contact your dentist to determine if a root canal is necessary. Remember, taking care of your oral health is essential for maintaining a healthy smile for years to come.